Healthcare is very personal, and I want to be a partner to everyone in Eastern Washington as it relates to improving what's working well in healthcare, but also fixing the areas that we need to focus on. And access to quality and affordable healthcare is something that we can all agree on. I am for more choice and greater competition to lower healthcare costs. I'm for improving access and ensuring that vulnerable populations get the care that they need and that they deserve.
The principles, the goals that motivate me as I evaluate any policy proposals. Number one, of course, easy to say, hard to accomplish, but nobody is left out. There's just no moral or economic sense to not be moving towards universal care at all times. And that's how we should judge both federal and state policies. Second, again, easier to say than to solve, but no family or business should face financial ruin because of a chronic healthcare condition or a tragic contraction of a disease or an accident. So, if I have the privilege of serving in Congress, I just have to tell you, I think that there will be new leadership in the 116th Congress. And I'm just going to come right out and say that I'm not impressed with the results of the 115th Congress when it comes to health care. And of course, my opponent is a leader in that Congress. Nevertheless, I call it a dismal record in accomplishing anything meaningful to improve access or to improve healthcare costs.
My focus is on the people of Eastern Washington, and I work for the people of Eastern Washington. And when you look at the legislation that I have worked on, the caucuses that I'm a part of, all of my priorities reflect issues important to the people of Eastern Washington. What is actually being done between the House and the Senate and the work that we're doing in our committees, that there is, when you consider 68% of the bills have had bipartisan support, 20-year high, that there is a lot of work that is being done in a bipartisan fashion. I've had 10 bills pass the House this year. All of them have enjoyed bipartisan support.
I believe we need to shore up and improve the ACA, not dismantle it. That would involve some of the solutions Senator Murray has been working on in a bipartisan way, and certainly means we have to shore up reinsurance opportunities so that we don't end up with people reaching those untenable costs that can't be spread across a larger population. And then finally, we need to use public health principles and public policy at all times to be analyzing and trying to reduce the disparities in our healthcare system.